Nurses play a very important role in quality and patient safety. When nurses use evidence-informed best practice, it leads to better and safer care for patients. For the past 3 years, Grand River Hospital has put in place best practices across all of its programs. We've been working in partnership with the Registered Nurses Association of Ontario to achieve the designation of a Best Practice Spotlight organization.
The Best Practice Spotlight organization is a partnership between Grand River Hospital, in our case, and the Registered Nurses Association of Ontario, or the RNAO. In that partnership, we work with the RNAO over the last 3 years to implement 14 different best practices. This is really important for the hospital, for our nursing teams, and for the patients, because it means that we're embedding the best practices to improve quality of care and patient safety.
The guidelines that Grand River Hospital put in place were developed through a rigorous process with experts across Ontario. These guidelines help our hospital meet the highest standards of care. In the next few minutes, we'll tell you about 3 of these guidelines and how they are improving the experience for patients. When someone falls, it's potentially life-threatening. And as our population ages, the likelihood of falls is going up.
The best practice guideline on falls prevention is directed at the older adult. Our patient incidents, which are considered adverse events at the hospital, about 80% are falls. First of all, we assess the patient to see if they're a low risk for falling or a high risk. And if they're a high risk for falls, that's when we kind of kick in and we put an armband on to identify them as a high risk faller. We do blood pressures to make sure that when they stand, they're not having a blood pressure that bottoms out when they stand, which would cause them to fall. We also make sure they have safe footwear, so we give them what are called gripper socks so that they can't slip on the floor. So we do a medication review. We talk to them about falls prevention, and we give them a brochure that they can share with their family members. We have signages on the bathroom so that they know where the bathroom is, because a lot of falls occur during the night when they're trying to get to the bathroom. So those are some of the components of our falls program.
Smoking is the leading cause of preventable death in Canada, so we're making a stronger push to help our patients quit and stay smoke-free.
The best practice guideline focuses on every healthcare provider that has contact with the client to consistently ask the client about their smoking history, advise them that the best thing they can do for their health is to quit smoking, assist them to be more comfortable when they're in the hospital, and then arrange supports in the community to support them to continue to stay smoke-free when they're discharged. We ask every patient about their smoking status. We advise them on the importance of quitting. We assess their readiness to quit. We assist them in their withdrawal by offering nicotine replacement therapy, and we arrange follow-up in the community to assist them in staying smoke-free. Smokers Helpline has a service where we can fax a referral form, and they will contact the patient when they get home and assist them with their efforts to stay smoke-free. And we find that it's really important because the incidence of them being able to assist people to stay smoke-free goes up when they contact them.
We know the team that works better together provides the best patient care. So one of the best practice guidelines has been to improve teamwork and the workplace for staff.
The best practice guideline that we've implemented in the operating room and recovery room is staffing and workload BPG, is under the Healthy Work Environment umbrella. We implemented this because we believe that a team that works together and is collaborative equals best patient care. There were 5 different key areas of issues we identified: internal issues, external, staffing, safety, and equipment. So we looked at the equipment issues and we broke them down, and some of them were pump issues, some of them were computer issues. So we addressed a lot of small wins in those areas to fix the smaller problems. One of our issues that we identified is that when the patient arrived in the operating room, they were not prepared for surgery in a lot of cases. So we developed a preoperative checklist, which is a communication tool from other units when they bring the patient to us. So they arrive properly prepared, which makes it a less stressful environment for the staff and the patient. As a result, we're finding a much more healthy work environment, less stressful staff, which equals better patient care.
It's opened the line of communication, I think, between our staff members, and I think we just feel a little bit more freely bringing up issues and things that are bothering us, and I think in the end that actually helps the patient. It makes it a safer place to work for both the staff and the patients.
Grand River Hospital has now received the designation of a Best Practice Spotlight organization, and we are very proud of that. But we're not done yet. We will continue to bring forward best practices, to participate in developing those guidelines, and to continue to improve the quality of care for patients.